Good morning. My name is P.McCARTHY. I'm delighted to be here this morning to talk to you about selective mutism. I know we're running a little bit later than we thought, so I'm going to try and make this short for you. My talk today is on my research on selective mutism, on the repercussions or the consequences of having had selective mutism in childhood, and how this could have effects later in adolescence. I began to be interested in this subject about 8 years ago, working as a clinical psychologist in Paris. I came to meet quite a few selectively mute children who were both selectively mute and bilingual. And I found that quite interesting, the notion of a silence in two languages. So I decided to start my research in that area. And this research essentially follows on from this some 8 years later, looking at these children and how they developed and what these consequences were. I'm sure all of you remember that selective mutism is characterized by a failure to speak in specific social situations. Although the child can speak often very well in the home and in situations with their parents. And I find it a very dramatic symptom as a clinician, because it's quite powerful when we see a child who doesn't speak, when usually we're used to children speaking a lot. Sometimes we wish they'd speak a little less or quieter. So it's quite powerful when we see a child who chooses to be silent. So there's the notion of selecting the silence. So just to refresh your memories on the criteria used for a definition of selective mutism: the consistent failure to speak in social situations, though we know they can speak and speak well; that the disturbance will affect some parts of their early development in terms clearly of socialization, in terms of learning, because often the teachers will not know if these children can read, as they don't speak at all in class or with their friends. There's just silence. That the silence has, or the mutism, has lasted more than 1 month, because we can't attribute this silence or mutism to lack of knowledge or certain reticence or shyness that we might see often in young children, and that the failure is not due to a lack of knowledge of the language. And that's an important piece in my research, because the children are all bilingual, and there tends to be, in my experience, a tendency for teachers to say, oh, well, the child doesn't speak, but it's normal, they're bilingual. And being bilingual is not a reason not to speak. So this has been often, I've found, a problem why the children end up not coming for treatment until they've been silent for sometimes 2 years, 3 years in class. And of course, there's a differential diagnosis that it is not due to another communication problem, not due to autism spectrum disorder. Just a few facts and figures. It is a rare disorder, less than 1% of the population. However, it's a growing disorder. And as we see, there are so many bilingual, multilingual children, there's so much movement in children at the moment, I believe it's going to become more and more of an issue. The mean age of onset is about 5, because that's typically when children start school. So this is one of the major separations. And this is why I was also interested in adolescence, because that in a way is another separation, another critical period. More girls than boys, 2 to 1. And there is some comorbidity on a milder scale, with perhaps a mild phonological disorder, certainly encopresis. Many of the children I saw did have toileting issues, because they're children who hold everything in, and they will not ask to go to the toilet, so that becomes an issue in the class. So one of my questions was, could selective mutism, as we know it, be a precursor to social anxiety disorder? Could this be sort of the start of it? Because we see some commonalities here. We see the fear of scrutiny, fear of ridicule, fear of looking anxious, looking like you're afraid of things. We see that behavioral inhibition, that slow to warm up temperament Chess and Thomas talked about. And we see that social situations are endured, not enjoyed. So in children, we see these behaviors of freezing, clinging, shrinking, attaching to the caregiver, and often failing to speak. So that was one thing I wanted to look at, whether this selective mutism in childhood effectively became social anxiety disorder at the age of adolescence. So the other factor we know about selective mutism, because there hasn't been an awful lot of research into selective mutism, and it has changed its classification many times to arrive in the DSM-5 as an anxiety disorder. One of the things we know is that there is a high rate of selective mutism in bilingual children. We see this with Turkish children in France, we see it in Israel, we see it in America, we see it across the globe. This is noticed. But this high rate of selective mutism in bilingual children often has sort of interfering factors, you could say. For example, there is a question of linguistic competency. Maybe the child does understand and speak the language, but they don't practice it very much, and therefore they don't feel very comfortable speaking it. Second, often the research has focused on immigrant populations. As we well know, immigrant populations are dealing with a whole lot of other issues to do with loss, transgenerational loss, dislocation. So that also maybe interferes with just looking at selective mutism there. And of course, there are cultural differences, because silence has different meanings in different cultures. And for a child to be silent in social settings may have a different meaning according to different cultures. So the research we have is often, you could say, not exactly pure, because there are so many interfering factors. So before I quickly introduce you to the research I've been doing, I need to take you back a little bit to the research I did 8 or 9 years ago, where I worked with these bilingual in English and French children who were selectively mute. They were absolutely mute outside the home, and sometimes they were mute with one parent in the home, even though they spoke both languages. So I was very interested in this notion of silence here. There were 12 females, 2 males, which kind of fits with our ratio. They met at that time all the criteria for a diagnosis of selective mutism. They were all school age. For me, that was important because I felt a young child of 3 or 4 could be showing normal childhood shyness or reticence. And so I wanted them to have been at school for a year or so, and that the symptom had not developed but had been there from the outset, and that it had lasted for longer than 6 months, so that it was well installed. So those were my criteria. Once I started finding my group, I made a call, and I had people coming from all over France, and so therefore I managed to get this group, because it's pretty unusual, as you can imagine. So I don't have a very large sample size, and therefore what I want to think about is how they experience this, rather than the numbers or anything like that. Briefly, what I found was that this silence in 2 languages seemed involved with the construction of an identity within 2 languages and 2 cultures, that the mother tongue played a role here, that sometimes the duality in the identity construction was difficult in terms of who am I, what is my identity, but also who am I like, who do I identify with? Do I identify with mother, the mother tongue? Do I identify with father, who is often the language of the country, or the other way? That the separation from the mother in an temperamentally, behaviorally inhibited child seemed sometimes like separation from the language, and then separation from what they had constructed as an identity from themselves. And that the silence in this bilingual setting seemed to be a compromise to not being able to manage this identity construction, this duality or loyalty issue, and that it didn't have one set reason, but rather it translated a unique set of circumstances and a very subjective distress, I would say, that could only be communicated through silence. So my understanding of the silence was not an absence, but rather it was a communication, it was a message. So, to the current research. All those children were treated, and most of them, eventually everybody will speak, but most of them began to speak within a year, maybe 2 years. They spoke quickly in the clinic, but it took them a long time to take that outside to school, to the playground, to outside in their little worlds. So they remained silent often for a year or 2 years, sometimes for 5 years. So it's a very long time to be kind of alone inside yourself for 8, 9 hours of the day, because French school has very long hours. So my question was, how did being silent affect them for all these years? What was it like to have a lot to say and to say nothing, and to keep yourself silent? So I wanted to see what these effects were on their social emotional development. As I said, to see whether there was a possibility that this led to social anxiety disorder. I also, now that they were speaking, wanted to hear what they had to say about this, to let them have a voice now that they were speaking many years later. I mean, they'd spoken earlier as well. So I found 12 of my adolescents who had been diagnosed with selective mutism. Now everybody was in adolescence from 12 to 16, and I asked them. I did 2 measures, a quantitative measure which didn't give me much information. Using the Leibowitz scale, only one of the 12 subjects demonstrated clinical social anxiety. On the child behavior checklist for children, there were no clinically significant findings for separation anxiety or social phobia, but 2 in the borderline range for social phobia. So not a lot of information there that would lead us to think that selective mutism did lead on to social anxiety. And then I did some qualitative research in terms of interviews, because that was my focus, as I say, to give voice to this kind of mutism. And the interviews focused on how it affected relations with others. I had my students give the interviews because I didn't want my presence, as I'd worked with these children, to influence how they spoke about it. I wanted to know how it had affected their self-perception, their evaluation of themselves at the time, and how they moved from a place of distress and silence to a place of coping. And then I wanted to know how it affects self-perception now that they're in adolescence. So the interviews were very open-ended. Tell me about what it was like for you. How did you feel about it? These kinds of questions. The themes which came up across these 12 interviews had to do with identity and identity construction. This didn't surprise me, as I had found that, and they were still bilingual, that this had been an issue. A fear of change and difference, and a move from self-protection to coping and resilience. And so what I thought is the best way to show you what was going on with them is to show you what they actually said. So I took a narrative approach to this to let them use their voices to talk about what it was like. So in the identity and identity construction, you see a lot of, I'm the silent girl, I was the silent girl, the one who couldn't speak, the baby, everyone called me the mute. So you can see that there was an absolute understanding and knowledge of the position that they had and the identity that they held for other people, for other children, and for teachers around them in terms of being the silent one, the mute. The second theme that was very common to the interviews was a fear of change or difference, which we might again predict because of the behavioral inhibition in the temperament. This difficulty of nobody expected me to speak. That was one thing I hear again and again with selectively mute children when they are speaking in the clinic. How can I go from being the one who was always silent to being the one who can speak? Because there's going to be such a change. They got used to me being silent. I stayed that way. It was easier. So there's an understanding that change may be, or a perception, I should say, that change may be difficult for everyone. It was impossible to suddenly be like everyone else. So an understanding of difference. And then from this self-protection, self-preservation to more coping, this notion that I could start to speak very slowly, and that there's a fear hierarchy that we work on, and then I could speak to someone else, and then I could speak in a small group, and eventually I could be at a place where I could be someone who is maybe inhibited, a little bit shy, never going to be the one jumping up and down, but that I could at least speak in a group. So this notion about gaining in confidence in speaking, gaining in people that the person feels confident with, to be able to take their personality from the inside to the outside. So a quick illustration of a case history. This is Clara, who is now 15, bilingual in French and English, speaks both fluently, did from an early age, French father, English mother, entered school at a young age, as is typical in France, and remained silent for 5 years. So when I say silent, it is literally silent. No expression, no nonverbal language, nothing. Almost like completely closed in inside herself. For the first 4 months, she didn't speak at all with me, didn't react very much with me. I wasn't absolutely sure that she could speak, though I had seen videos of her, so I knew that there was something. And then when she did speak, completely fluent and in fact cheerful and voluble and very communicative girl, but couldn't take it to outside. So it took a long time to make that bridge between what she was able to do with one person to what she was able to do in a social setting. So I meet her now at 15. That's always strange for us when we see them grown up into adolescence. And she doesn't, on any of the checklists, she doesn't show any symptoms of anxiety. She has a mild specific phobia, spiders, but it's very manageable. So I'm not seeing that there is a lead-in to social anxiety disorder or social phobia. In terms of the themes from her interviews, we see she talks about herself as the shy one. I was a mute, I was speechless. Then this notion of when I did get my voice, I was afraid that I wouldn't actually think of the words to speak. I'll be the shy one in my group. So the identity kind of moved on, even now as 15, completely speaking. She's been speaking since she was 8, but she still sees herself as the shy one in the group. The fear of change and difference, the scared about being judged. You can't go from being mute to a talker. I'd say the wrong thing. I was shy. And still, again, this fear of change now. I don't particularly like new situations, meeting new people. I remind myself not to think too much about me. So she's learned to do that decentering thing, and she's using it as a coping mechanism. And the final theme, from self-protection to coping, this notion that it was gradual, that it had to do with this hierarchy in terms of being able to move through it, having comfort with one person, then another person. And this idea of, I'm still a little shy, but I always do try to break through at the start, because if not, I'll create a blockage for myself and it'll just get harder and harder. So you can see this notion of kind of coping and a little bit of awareness and understanding of, this is who I am and this is what I have to do, because when I do this, then I can move. So little pieces there of residue, you might say, of what it was like to be selectively mute through childhood. So the commonalities that I found in the narratives, that this experience of being selectively mute in childhood does leave a residual trace, and the trace seems to be related to fear of humiliation, a certain embarrassment, a certain awareness of oneself as a little bit different, but not necessarily affecting too much relations with other people. Has an effect on identity construction. Perhaps this is also the bilingual piece, but if we just take it as selective mutism, it did seem to have an effect on identity construction about who I am. I find increased self-awareness. I mean, if you hear some of the things, there's a lot of self-awareness there. There's a lot of articulation and about who I am and what I need to do to be me. There's self-protection and seeing the self somehow as in need of protection. And then there's this notion of, I have some skills for coping and that I can use these skills. So, in as much as you can draw conclusions from a small sample size, I believe that qualitative research allows us to understand a subjective experience, and that adds to our knowledge and illuminates what it might feel like subjectively to experience selective mutism. The research that I've done does not necessarily predict that the child who has experienced selective mutism will later have a psychopathology or social anxiety disorder. That the early experience is formative, as we would expect in terms of identity construction, but also in terms of developing coping skills. That early intervention is very necessary, because many of the children that I saw had already been mute for 2 years. And when you've been mute for 2 years, funnily enough, it's easier and easier and easier to be mute. So the longer it went, the harder it was. So if I met a child who was 9 or 10 and who had gone to school at 4, it was really hard to get that moving. Where if it was 6 and they had gone to school for a year or two, it obviously was much easier. So certainly early intervention. And for me, I guess, in terms of what I got from the quantitative and the qualitative, it sort of confirmed my own bias that we can ask our patients, and if we ask them and give them the opportunity to tell us, they will tell us what it's like, what it feels like to be them. So implications for future research. Interesting to look into temperament, early behavioral inhibition in infants, so that we could even start to see this at an early stage and try to put some measures in place to help the child quite early on. I think we need a lot more research into what this feels like. Interesting research could be in adulthood, after they've been through this critical period of adolescence. And I think another interesting piece could be to look at what it is like to construct your identity within a psychopathology, in terms of if you are labeled or diagnosed as having a psychopathology as a child or adolescent, what effect that might have as you construct your identity throughout your development. Thank you for listening. Does anybody have any questions or comments? I gave you a lot of information very fast, I know. No? It's clear? Okay. All right.